Hello everyone. Good morning. Welcome to Teach Connect. Today we have our dental expert with us, Dr. Harika, to explain us on how the common problems we usually face in our day-to-day and the precautionary measures in the tooth. So let's have a discussion with her on the common problems what we face in our day-to-day life. Hello ma'am, good morning.
Hello, hi, good morning. Good
Yeah,
morning, everyone.
yeah. Welcome to Teach Connect.
Thank you so much.
So actually today we are here to have your tips and suggestions with us on the basic common problems usually the children face. Like usually we tend to convey the children like if you eat chocolates, if you eat sweets, you'll get the cavities, etc. How far is it true? Like what problems which you are conveying right now are the main reason back of it is the same one, eating plenty of chocolates and sweets. Are this the one?
Taking plenty of chocolates and sweetness, definitely chocolates are all junk, but still
Hmm.
children love them a lot. We cannot
Yes.
refrain them. So definitely we cannot avoid totally. What we can do is once they eat chocolate or any junk food, they can just ask them to simply gargle their mouth with a plain
Okay.
water at least. And after that, brushing at night time by the parent.
Hmm.
Those particles which got stuck onto the tooth surface, they'll be removed and there will not be any problem. Sweets and chocolates, as their sugars, definitely they are more prone for cavities. That's why proper cleaning will not cause any harm if you eat chocolates also.
So we have
If
to
they get
habituate brushing
just,
like
brushing
morning
and
and bedtime.
rinsing with the water. Brushing has to be done by the parent till certain age.
Okay.
And before that, what we can accustom children is we can just ask them to gargle with plain water every time they eat some junk food or stuff, sticky food. We can ask them. We can just they'll enjoy that also. With the water,
Yeah.
any kid would play. So definitely they will do that. They will get accustomed to that habit.
Yeah. Anyways, they love spilling out water.
Yes,
So
yes, that's right.
definitely it
It's
has to
like a
make
fun
it.
for them. Definitely they will enjoy.
Yeah. And also like most of them will be having some yellow stains on their teeth. So once it appears, do they have to visit the dentist or what might be the cause for that? How they will, what is the reason for that?
Yellow stains mostly because of the plaque accumulation on the tooth surface.
Okay.
Stains are formed due to that only. So, as a proper brushing, as I said before,
Hmm.
proper brushing, a sweeping motion up and down, and circular motion will remove the yellow stains. If the and there are certain stains if you are taking multivitamin syrups, iron syrups, especially
Okay.
those medicines and antibiotics in certain cases also will cause stains, which can be properly identified by a dentist. And you can
Mm.
ask the suggestion of the dentist depending on the cause they rule out.
Okay. So are they permanent stains or can be removed and like it's a time
They,
being?
they will go. They will go. Nothing to worry.
Okay. So they have to consult a dentist for the cleaning of it. They can like frequently they have to brush the teeth or
Definitely they have to because yellow stains are, as I said, they are plaque. Plaque
okay.
on the for the longer time will cause cavity.
Okay.
Again,
Hmm.
chindan are bad for your teeth, right? So
Yes.
definitely that has to be treated by a dentist.
Okay.
And
So
proper
most of the
awareness
children have to
of
observe
brushing.
this one. They have to notice this one. Whatever
Yes,
there is,
yes.
the ultimate cause is like they have to brush their teeth in a proper way.
Yeah, in a proper way and just taking more water, more quantity of water.
Hmm.
These simple things, prevention is better than cure.
Yes, yes, we
That
all fall. Yes.
in kids, because if they come for treatment, more than the treatment, behavior management is main for them. They have a lot
Mm.
of psychological fear for the dental office. So if we take in the earliest stage, it would be easy for them and the parent and the kid as well.
Yes, as well. And also, like we'll see many of the children when they're playing or accidentally their milk teeth will be broken. So, like
Yes.
a few of the parents, they will be leaving like, okay, it's milk teeth, right? We'll just leave it off once. Anyway, it's it will go off, right? It will be replaced with another new teeth again. So is this the thing we have to neglect it, or do we have to take in special care on that? Like we have to visit a dentist on that. Does it affect the upcoming tooth again?
Uh, Good question actually. Uh, Most of the children will have upper front broken teeth due to the any
Yes.
like an accident or something like that.
Hmm.
Definitely, as the upper front teeth, the permanent upper front tooth will come at the age of 6 to 7 years of age at least.
Hmm.
And your milk tooth has to be taken care.
Yes.
You cannot leave the broken means the inside the pulp of the tooth, the tissue inside the tooth is affected, right? It
Hmm.
gets infected and it will give you pain and infection. So if you cannot leave it like that, definitely it has to be attended. And
Okay.
later on, when till it sheds off on its own, we have to take care. Otherwise, if you lose a tooth at an early age before the
Hmm.
eruption of the permanent tooth, the space is occupied by the other adjacent tooth or something like that, especially in the back molar areas. So the space for the permanent tooth has to be preserved.
Okay.
Yeah, that has space maintenance, we call it as. Till the permanent tooth erupts in its place, we keep the space intact. We try to maintain the space. So that treatment is required for the kids who lose the teeth, for
Okay.
milk teeth and an early age than the prescribed.
And also, like when they hit, like when they're hit very stronger, like when the tooth breaks, also there will be a like. Does there any problem in the nervous system? Are the nerves damaged when they hit something? Like they'll be hit with a lot of pressure, right? So will that affect any nerves over there?
Definitely in the tooth which got impacted with the injury. That's it. There are no other nerves and all involved. So
Okay.
just the tooth got impacted. That will definitely the nerve of the tooth will get infected. We do treatment for that particular tooth only.
Hmm. Oh. And
And
also,
in
hmm.
cases we just wait and watch. A
Hmm.
regular follow up. If the kid is around 5.5 year or old, at
Hmm.
that age, if he gets if the front tooth is broken, so we just wait and watch for the symptoms, and because he is near to the eruption, right?
Yes.
The
Yes.
common tooth is near to the eruption, so we just wait and watch. With a regular follow up, we can manage the things. Not always invasive treatment is required.
Yes. And also, like grinding the tooth will be a major problem. Like we can see in many of their kids in when they sleep, when they are in deep sleep or something like that, it's grind their teeth. So, what
Yes.
might be the reason behind it? Like, you see, this thing is upsetting most of the children.
Yes.
So, what might be the reason? Like, isn't any does it affect something, or what is the reason behind it? So, do we have to neglect it?
No, no, you cannot neglect it because night grinding of the teeth will cause the wear and tear of the tooth surfaces, which again they will
Okay.
face headache and all due to the night grinding. And most common reason would be anxiety in the kids
Mhm.
and difficult with the nasal obstruction. In that cases, they get habituated to the mouth breathing, especially in case of enlargement of tonsils. And if they have any gastrointestinal disorders, they tend to attain this habit of night grinding.
Okay. So
So
that
till
is
the
also some problems in the intestinal problem also that helps.
yeah, digestive issues and obstruction to the nasal obstruction. If there is any nasal obstruction,
Hmm.
definitely they tend to uh, attain the mouth breathing habit. That
Hmm.
also causes night grinding.
Okay.
And
So,
night,
hmm.
the source of the problem till the source of the problem is resolved, we just give night guard to such kids, which is just a simple tray which they
Hmm.
can wear at night, which will prevent them to discontinue the habit slowly.
Yes. And also, like we'll see, like usually most of the adults, let's see that adults, we usually face this problem in the adults. Like we'll have toothache, commonly toothache we'll be having. So what they'll do is usually we'll just pick up some tooth painkiller and we'll just have it. So like
Yeah.
for that instance of for that night, the pain will be washed off. So again, if they take the painkiller for 1 or 2 days, it will be. So is there any need of visiting a doctor or like self-treatment? Is it well? Because once we visit doctor, sometimes doctor will prescribe. He will be prescribing one medicine. So usually, what everybody will do, the same medicine they'll be repeatedly doing once the issue persists. So again, they'll be using the same thing. We usually see the same procedure. So is it the way self-treatment? How far it's good, like doing self-treatment and all?
Not at all advisable.
Hmm.
As one thing is, if you get a fever, you take some paracetamol, the fever will be gone. But
Okay.
your body has a natural mechanism of getting back to the normal, but tooth cannot repair itself. So
Okay.
if you take a tablet, the infection will be there only, just the symptoms will subside for time being. That's it.
Okay. Mm.
Infection which is there inside your teeth, it keeps on destructing your teeth continuously. Even if you take the painkiller or the antibiotic, the infection will be there always until we remove it from the internal treatment. So that only a dentist can remove,
Yes.
can help you in that case by treating the tooth. Medicine, external medicine will not give you any solution. It's just give you the temporary relief. Definitely after even if the pain is subsided, if you notice there is a tooth decay or any issue with the tooth, you should definitely visit.
We also use, like, many of them will be using the toothpicks as well after eating. So does it create any gap between the tooths, or because we use most common thing, like they'll just pick up the toothpick after their dinner or lunch, after their meal, they'll just put it in their between the teeth to remove that unwanted stuffed food particles. So is it the thing? Does it create generates any gap between the tooth?
Yes, that it generates gap between the tooth, and it affects the periodontal health, gum health of the individual also. It's not at all a good
Okay.
practice. Instead of toothpicks, you can use interdental toothbrushes, which are very good in removing the food stuck in between the teeth. And floss, thread floss is there, and nowadays water flosser is also there, which is like a hand gun. You can just use it with very easy, quick and easy method. Water
Hmm.
flossing you can use, and the general thread floss, you can interdental toothbrushes. All these are aids which remove the food accumulation in between the tooth. As I said, definitely as the food accumulation is happening in between the tooth, that means there is some issue there.
Hmm.
First idea is to remove the cause, remove the
Yes.
source of infection, and remove the root cause of the problem. So attending that the particular problem will solve the issue.
And thank you, ma'am. Thank you so much for having a session with the Teach Connect and helping our team to build up, grow up in a very good environment. Thank you, ma'am. Thank you so much. We'll definitely get back to you with
Thank
some other tips and suggestions as well. Thank you, ma'am. Thank you so much. Yeah, have a great
thank
day,
you for
ma'am.
the
Thank you, ma'am. Hope today's session is quite useful for everyone. For more videos, please like, share, and subscribe our channel. Thank you. Signing off, Sindhu.